Welcome, everyone, and thank you for joining us today. I could not be more excited to have this time to share an exciting effort that is very close to my heart, reimagining community health systems. And just quickly, I want to share our agenda for today. I'll provide a brief introduction to both the Reimagine series more broadly and the Reimagining Community Health Systems Challenge specifically. We'll move to hear about the experience from our guests from the National Association of Community Health Centers and the Iowa Primary Care Association. And then we'll hear from the participants from our corporate lead sponsors, SAP and Medtronic. And finally, we'll take your questions and provide answers. Please do send in your questions as they pop into your minds over the course of this time so that our team can start collating them and getting them queued up for that session. So I mentioned the guests from the anchor partners and the lead corporations. Here's just a quick snapshot of those you'll hear from. I'll introduce each of them in this session just before we hear from them in the interest of time.
This is super distracting for me. Why are we doing school down here? I have my webinar. It's very distracting.
For those who don't know Pixera Global, just a quick view of who we are. We're a social impact organization, and we're celebrating our 30th anniversary during this very complicated year. Over those 30 years, we've worked in over 100 countries, and we've partnered with well over 30 corporations, over 100 government agencies and institutions, and more than 30,000 local organizations to solve complex global challenges on a local level. The Reimagine series is something we're very excited about. It was born this past spring as we all woke up to the pandemic and its potential impact across sectors. As we looked at all of the vulnerabilities exposed across the globe, we wondered if the pandemic didn't provide actually an opportunity to rethink, to redesign, to reimagine systems that were increasingly proving not to be reliable or resilient. And each project in this Reimagine series is designed to bring multiple viewpoints and potential solutions to challenges such as healthcare delivery, small business recovery, environmental sustainability, economic inequality, or racial injustice. We've set this up as a challenge where an anchor partner who has the need and potential to make systemic change puts a big question, big bold question on the table, and teams of corporate participants learn from key stakeholders about the problem and bring new solutions driven by diversity of thought. Multiple multi-sectoral teams, judging teams, including the anchor partners, select a winning idea, and then some seed funding is made available to the anchor partners to pilot or to accelerate the solution. We announced our first Reimagine series challenge at the end of May, beginning of June, conducted pre-work in July and launched in August. And today you'll hear the results and reflection of this first in the series. Here you'll see the core challenge that the Reimagining Community Health Systems challenge was based on. Limited access to healthcare in underserved communities has been exacerbated by COVID-19, no surprise. The inability to access basic healthcare services leads to even greater inequalities in other areas, including education and economic achievement. The Reimagine Community Health Systems Challenge brought together the power of cross-sector partnership. Both Medtronic and SAP are longtime partners of Pixera Global in our global pro bono practice. With Medtronic Foundation, we were discussing how to take on immediate COVID response projects, so it was a natural segue to think about what a more systemic, long-term, nationwide program might look like. SAP has always been willing to innovate, to try new approaches to bring in corporate resources to address social challenges, and they've been the clear leader in multi-company opportunities, so it was an easy match there. We were thrilled also to have BD and Celanese join in, seizing this chance to give their employees an opportunity to help to address the pressing issue of access to healthcare. In parallel with bringing the corporate partners on board, we went through an intentional, intensive scoping project with the anchor partners to come up with scopes that were achievable for the employees in roughly 5 hours a week over a 4-week period. So before we jump into what the actual problem statements were after this scoping process, I'd like to offer a quick poll to all of you so we can do a little level setting. So let me ask this question. Approximately how many Americans rely on community health centers for their health care? Give you a couple of moments to respond to that. Well, I see we have an audience more than half made up of good students who hopefully read some of the background or knew something about community health centers coming into this. The correct answer is 30 million. Almost 1 in 10 of every person in this country accesses health care primarily through community health centers. It's a stunning statistic. We rely on these health centers in a way that many of us may well not have been aware of. So let's talk about how we can support those community health centers in serving those 30 million people. The first thing we did was to work with the National Association of Community Health Centers to come up with this problem statement and anticipated impact. So NAC's big challenge was to create a business plan around telehealth so that it could serve its members well in this space. For Iowa Primary Care Association, it was the development of a framework for integrating telehealth across its statewide network in order to improve access and outcomes for highly underserved populations. So 2 related but distinctly different challenge statements for each organization. Now, what made the challenge feasible to accomplish for these teams in such a short period of time was some intense preparation or pre-work period where the teams were able to get to know one another and really fall in love with the problem they were trying to tackle, not with their preconceived solutions. During the challenge period itself, it was the voice of the stakeholders, both internal and external to the anchor partners, that made solution generation possible. For example, in the first couple of weeks of the challenge, teams heard from approximately 20 different stakeholders through panels and interviews in this virtual world we're living in, including leaders of rural community health centers, and also from HRSA, the Health Resources and Services Administration, from the government and policy perspective. And in the end, there were 40 participants on 8 teams with 8 solutions developed, highly complex solutions in many cases. 8 judges weighed in to decide upon 2 winning solutions from the cross-company teams. So that is more than enough from me for now. Let me start this next section by introducing Jason Potnush, who's an Associate Vice President at the National Association of Community Health Centers, and Sarah Dixon, who's the Senior Director of Partnerships and Development at Iowa Primary Care Association. You know, it's so interesting. It seems like it was a lifetime ago when I first spoke with each of you about this opportunity. I'm so grateful to you for being here today, but also for your willingness to bring your organizations forward for the Reimagine series. You were, frankly, our guinea pigs. And I just have to start with the first question. Why in the world did your organization take this leap to join the Reimagine series and this first challenge? Jason, let's start with you.
Thank you, Deirdre, and thanks to the whole team at Pixera for inviting us during this. I've been called worse things than a guinea pig, So it was fun to take on this challenge. And I think it's important to give everybody just a quick snapshot of the community health centers. As you pointed out, we see 30 million patients on an annual basis throughout the country at urban and rural and frontier locations. These are health centers that are serving homeless populations, school-age children, families, agricultural workers, those in public housing residents, and also anybody who walks through their door, essentially, is an important thing to remember about community health centers. Also, these health centers are governed by the users of the health center. Over majority of their boards are actual consumers of the health center, making them the only patient-run healthcare system in the whole country. And so we approached this in the same way that I think the rest of the world was waking up in early March, well, goes back to January, but really for the US, early March to realize something was about to happen with COVID-19. And for the first time, outside of natural disasters, health centers had to close their doors physically to patients coming in for the safety of their own staff, but also for the safety of patients. And so this meant that they had to find alternatives to reaching out to some of their most vulnerable patients. These are patients who are managing chronic illnesses like diabetes and hypertension. These are patients who are also managing behavioral health diagnoses, substance use treatment, patients who may have killed children with asthma or other illnesses that they needed to still reach out to. And so telehealth immediately jumped up to the forefront of their priorities to figure out. When we think about telehealth, this was, the analogy of trying to build a plane while flying it is something we think about. But I would actually add that we were also looking for all the parts, wondering who the pilots were going to be and the staff, and wondering actually who the passengers on this would end up being, who was actually going to pick up a phone or a computer and do a telehealth visit that they've never done before. So we knew that the health centers were responding one by one to this, but as an organization, we had to think quickly of what was going to be needed and focused our efforts towards the policy response, the legislative responses that were needed for payment on telehealth visits, that were needed on some of the regulations managing telehealth, just thinking about which kind of providers could provide it, where they could provide it from, very detailed items. But we also had to think about sustainability from an organizational standpoint. And this is where I think Pixera and the Reimagining series came into play most, is that as an organization, we would have loved to have the kind of ramp up time to think for 6 to 12 months of how do you create a training programs on implementing telehealth for your health center, what are the payment and policy models you can look at as a health center, but we barely had 6 to 12 minutes to get this started. So we needed help with this, and the timing of the Reimagining series and the discussions with you and your team early on were perfectly timed. And so we saw it as a risk we were willing to take. And I use that word risk in a way that not a lot of us on staff understood pro bono approaches. Some of us have experienced them. I think the experiences that we had was the mix of like, I had a great experience with a pro bono team, to it took more work than was needed for our staff. We could have just done some of this work. And so we had a mixed bag. And so it took some convincing of management to move forward at this moment in time where all of us were already on 14 to 16-hour days, in addition to figuring out home caregiving items. So it took a chance. We said, okay, it makes sense. And we identified the team necessary to bring it forward. And so I think that's, the opportunity that was in front of us to think about sustainability as an organization, how we provide resources and guidance in telehealth, made that the determining factor for us.
Fantastic. Thank you so much for pointing out that issue of the risk and getting the internal stakeholders on board. It is an investment on the part of the anchor partners for sure. And it's really hard to make an investment like that at a time when you're so stretched. So thanks. I'll turn the same question to Sarah. What made you leap into this pool with us? We can't hear you, Sarah. It wouldn't be 2020 if we weren't having a tech challenge. We still don't hear you, so I'm going to give you a minute to get your mic sorted out, and maybe I'll have Jason take another question while you sort through that. Jason, from this experience, you were very focused on your unique challenge around telehealth and the business plan. But I'm sure your strategic mind stretched to other directions. How would you imagine something like this type of challenge being able to support other social organizations to solve problems? What popped into your head while you were working on this?
So as the National Association of Community Health Centers, we represent the 1,400 health centers, 52 state primary care associations like Sarah with the Iowa Primary Care Association, and then 20 plus health center controlled networks throughout the country. So we have a very large base audience that we are supporting. And so for us, we wanted to not only work with a pilot like the Iowa PCA as one of the pilot sites, but also experience it ourselves. If we couldn't make it through the process, then how could we feel confident to bring this kind of opportunity to other PCAs, other health centers, other partners, and say, this is worth your time and energy. This is something that you should pursue. So it was very important for our staff to really just get on the ground and do it and be part of the challenge. And what we wanted to do was also for the groups that were involved from the corporations, we knew that they were starting from a level of education where they're not going to know every detail about community health centers, and how we were able to pump all that information to them in a quick manner. We knew we needed champions from the field, and so it was very important for us to set up the engagements and the office hours for them with leaders from health centers, with leaders from the primary care associations and the health center control networks, but also because these are our customers as a national association. We are advocating for the 30 million patients every day, but we know our first level customer is going to end up being the agencies that are providing that care directly. And so we want them to have that experience with our customers. And then the other group we also want to bring in were our other customer, our federal partners at HRSA. So it was important to hear from all of these audiences, in addition then to hear from NAC staff who are on the ground every day, providing training, providing technical assistance. What are the policy issues impacting the community health centers and telehealth, and what are the who are the partners that are coming to our space? I think outside of being barraged with PPE offers from all over the globe on the early days of COVID, my next most frequent call were telehealth vendors, and we didn't know how to drink from that fire hose right away. We had to put the brakes on all of them to say we have to assess what we can recommend and what we can bring forward. And so I think for our staff, bringing these voices to the table help to make it a more rich process, and how we would actually advise like even other PCAs, health centers, and hopefully as we go along in our pro bono journeys in the future, how we would suggest other groups to get involved.
Fantastic. I have a couple follow-on questions on that, but I'm going to see. I think we have Sarah's. I think we have Sarah back.
Can you guys hear me?
Yes, now we can. Perfect. So
Excellent.
that same question, Sarah, of what made Iowa PCA decide to jump on board with this?
Yeah, Jason did such a great job framing, I think, the challenges of the populations that we serve and then the health centers themselves. And so what we experienced in the spring was really health centers trying to actively, quickly stand up services for telehealth for all the reasons that Jason talked about. And our organization saw the opportunity, I think, with the Reimagining series, because we knew that what health centers were going to stand up may not be the best workflows, the best solutions. They were putting, stopgap measures in place in order to save their organizations and ensure that the patients that needed care could get it. And so when Pixera Global approached us and NAC approached us, we really saw this as an opportunity to not only hopefully do in the short term telehealth really well, but then also start to think about the way in which you embed telehealth into your care model overall, because you could see right away that we were having some really good success engaging patient populations that we had struggled with historically for decades. And so all of a sudden the light bulb started to go on that this was just such an opportunity to not waste a terrible, terrible crisis. And it felt like the Reimagining series was just having a series of presents that you could open kind of along the way, because not only did we benefit from the process, and I think the strategic thinking and just really good stakeholder input, we also got the thinking of 40 different people and all the ways in which they might have either personally been able to use telehealth or things that they maybe had seen in other areas of their work. And so just that, the broad look at it, the strategic look at it, and the voice of the customer, all those elements were so attractive for us as we were considering joining the challenge.
Thanks for that. Yeah, that idea of being strategic and thoughtful that you both raised, being strategic and thinking about sustainability when you're in the middle of having to stopgap things. It's really hard to devote resources to that, but it's just it's so important not to miss the opportunity. You both mentioned stakeholders quite a bit, stakeholders and customers in your comments. I'm curious as to what the experience was bringing those stakeholders and customers in, and whether that also helped to kind of deepen the relationships with them in any way. How did they respond to this opportunity?
Yeah, do you want me to start with that one, Jason?
Yeah, why don't you start? Great.
I'll talk a little bit about who we brought in. So in our project, we were able to bring in 3 different just patient voices from across the state. We also talked to some key members of the care team, so 2 providers. Leadership from our health centers was very important. And then the other really important voice was not only the network, so our staff, and then the payers that were working with us hand in hand as we were all trying to figure out how to deliver care and access during the pandemic. And so I would say just starting at the top with the payers, the challenge allowed us, I think, to really better understand the payers, really where they saw opportunity and what they were interested in better understanding about what telehealth could bring to the delivery system and improve quality and lower costs. And so I think learn some things about partners that we already had in place that help us to grow and even deepen our relationships with them, because we better understand their sentiments and feelings and just their strategic objectives related to telehealth. From our network, the CEOs at the health centers had always been dancing around telehealth and trying to figure out how to do it. And these rapid shifts in being able to be paid, I think, really solved some of those problems, but presented some new problems for them. And so being able to talk to our network leaders, I think, really showed us that in public health, a lot of times we talk about you come up with a solution, it'll work for about 80% of the population, and then there's the other 20%, and they are individuals that we're asking, what about the other 20%? So just a deepening of, I think, all the different ways we need to think about telehealth and how it can be a tool for us. From a care team perspective, and a patient perspective, I think those interviews were incredibly enlightening in that they're looking for ease and they're looking for a solution that's integrated, and carrying those things out of this process and then back to our health centers is going to be, I think, some of the most powerful input that we can share with them from the process. And so I guess just want to underscore how important it was to talk to the stakeholders and just be able to use that information to really reinforce the way in which we're thinking about telehealth in the long run.
Love it. Thank you so much. Jason, what can you add to that?
I think adding from what Sarah said, and the PCA did a great job with definitely the coverage of patients. It was not the immediate audience that we were looking at from a NAC perspective for our business plan development, but felt it was excellent that they were taking on that approach, because I think it really helped the different teams understand the patient perspective more and what that experience is going to be like. Same with the providers. For us, we wanted the teams to talk to those direct NAC customers, who are the state primary care associations and the health centers who turn to NAC, whether it's for training advice on how to operate their health center on a daily basis, or it's support on how to get state policy passed to inform payment for health centers. We wanted them to talk directly with them. So selecting those speakers was essential for us. And we looked at it from not only ensuring that we had big health centers, but small health centers. We had urban coverage in our PCAs and rural coverage in what they talked about. And our health center control networks really talked to them from the aspect that I thought that came out very interestingly is the speakers didn't want to be in competition to NAC. And they thought that this was a really great universe that we had to work together in. And that really came through on the different proposals that came back from the teams. And so that we could see that the teams really understood what the needs were, and that also they understood where could there be potential challenges? What do we have to watch out and not step on our own feet, getting in front of ourselves on the business plan development. So that was important, I think, in what we saw as the results of them talking with those different speakers. I think then the last thing, when we focused on the talks with internal staff, we broke it down into two groups. We broke it down to the subject matter experts, who were the policy experts, the care delivery experts for telehealth. And then we also broke it down to who were we labeled them the external whisperers. And these were the people who deal with vendors on a daily basis, whether it's for our exhibits at conferences or other vendors for partnerships, but also those through our affiliated partner that does business development, talking to them to hear what are we hearing from the vendors. And I think that was much more helpful than just picking and choosing different vendors from the field, because we realized that the external whispers have a job of triaging what might be the shiny object in the field coming to NAC to try to get to the health centers, and otherwise walking them through the rigor of partnering with health centers and talking about health center populations, or showing them that they have some more learning to do. And I think that was helpful for the teams to recognize that we just can't open our doors to everybody. And it came through in their different reports on how to build, the smart business plan forward.
I love the way you structured that, and external whisperers is my new favorite term. And they're so often left out of the conversation. So that's terrific. I have one more question for both of you, maybe just a minute each, and then we'll come back during the Q&A session. The final question is, it's been a month since the judging. What's next? What do you see happening from here? What's going on today, and where do you see this going?
Yeah, I can just really quick and give a quick minute response. So we have really been thinking about the way in which the findings from the fabulous 4 proposals that we received can now be integrated into our overall strategic plan. So we have a eHealth goal in our strategic plan. That's a 3-year strategic plan. And we are going through and doing some ideation work with the Pixera team to bring all of the pieces together as a network, bring our staff along, and then really focus on when we have completed that ideation session, really bringing a version 2 of a proposal back to get additional health center input from the state of Iowa. And we're very excited to be able to do that. So trying not to, we're trying to be very intentional and thoughtful about all of the ideas that came our way, and deciding what we can tackle first and what's the most important thing for us to do those deep dives on, and then some of the very innovative solutions, just where do they fit in, and thinking about just timelines for implementation. So that's where we are as an organization.
Fantastic. Jason.
It has been a quick month, since, and it was a very quick 6 weeks going through the challenge, which ended the challenge for NAC. It ended simultaneously timed with our first virtual annual conference. So just catching our breath after that week was, realizing what was most important. I think coming out of it, though, we've now updated internally, an internal telehealth work group that we had been working with across our organization. We've also updated our leadership and our vice presidents. And so moving into those next stages now of how do we operationalize, some of these recommendations and come back to Pixera and the team, the winning team, the Revolution team, to say, this is what we'd like to go forward with. But also from those other presentations, all of which we valued greatly, what other snippets could be there? What other aspects of those other proposals that came through can we build off, both in the short term and the long term for the organization? I think as we look at it, to get the amount of input that we had from the teams and working with them, to have that level of engagement, and then also the quality of the presentations that come in, we value those, that would have been probably $50,000 to $75,000 engagements just with each team if we were to contract that out. I know that number might be even a little higher than Pixera's own estimates in it, because I think that's market price, but then we know consulting firms have the plus price that they may need to put on to some of these things. So if we were to go out externally, that's where we have seen some of this value now come back to return. So we want to make sure that we're taking the next proper steps forward in how we think about this.
I love that you both mentioned the winning solution, one thing, but there was lots of other meat in the other solutions. And I had the pleasure of sitting and observing on the final presentation and judging sessions. And I don't even know how you chose between them, because they were just such terrific ideas on the table and different elements of really great things that I took some back to our company as well. So, well, thank you both for this moment. We're going to come back to you during the Q&A. Feel free to turn off your cameras and take a little bit of a break here. And I'm going to bring forward a couple of the participants to share their experience. So I'm going to be joined now by Susie Moscow, who's a senior manager at Medtronic, and by Fouad Sadiq, who is a development architect at SAP. Fouad and Susie, thank you so much for joining us. Thank you so much for being part of the team and contributing your time and creativity to this opportunity. And I want to start by asking you both the same way I started with the anchor partners, which is, there's so much going on now. The world's so crazy. The last thing you need is another Zoom meeting and another virtual engagement. What made you decide that you wanted to participate in this opportunity? And I'll start with you, Susie.
Sure, thank you. So personally, I have a passion around removing barriers to access for patients, healthcare providers, and caregivers. So this challenge seemed to really fit into that. In addition, living through the pandemic, COVID-19 really seemed to shine a spotlight on the inequities that we have in our care delivery models. So this challenge gave me an opportunity to not only imagine a better delivery model and a better way to expand access to healthcare, but to actually be a part of the solution as well. So that was the main motivator, was so that I could be a part of the solution and a part of making a difference.
Great. Good.
Okay, for my side, I chose this challenge because volunteering promotes well-being, alters self-perception, promote appreciation, allowing people to build confidence and self-esteem and to learn new skills. Like at SAP, 93% of employees acknowledge the importance of pursuing purpose and sustainability. And this challenge came part of the SAP corporate social responsibility portfolio that empowers us to take action around causes that we care about. Back in 2019, more than 20,000 SAP employees volunteered, dedicating more than 270,000 hours of service in more than 58 countries. 55% of all volunteer hours were skills-based in support of our innovative programs, building digital skills, workforce readiness, and youth entrepreneurship. This challenge was an opportunity to make a change and to improve people's lives during COVID-19 and beyond. It was a great challenge with a direct influence toward physicians, patients, health community centers. So I want you to be part of this journey to promote better community health service and high quality care regardless of the patient's location and care type. And myself being a volunteer ambassador at SAP, and with all the barriers of healthcare for local communities during the pandemic, I found this opportunity to match to my passion and professional skills to make a change and to improve telehealth services.
So it's clear you both have a passion both around the healthcare side of it, as well as just making a difference more broadly, and embracing this volunteer opportunity. I wonder how the experience was itself. How did your teams perform? How did you work together? What really stood out about the experience for you? Do you want to start, Susie?
Sure. So I feel like our team really embraced this challenge and that we worked extremely well together, especially considering we had never met, we had never worked together before, we were just meeting each other for the first time. And as you mentioned earlier, that opportunity to fall in love with the problem really helped us find a cohesion as a team. So by falling in love with the problem, we could create a shared vision, a shared understanding of the problem, as well as our shared purpose for the team in trying to solve the problem. What were the skills that we brought to the table that could really benefit NOC? So it gave us an opportunity to also look at the problem from the skills that we brought to the table, as well as how we wanted to develop as individuals, as well as employees. So for some of us, there were particular skill gaps that we were looking to close through this challenge. And by vocalizing that, we could set up responsibilities and action items and tasks and plan accordingly, as well as provide additional support for that individual via another team member who may have that skill and be a coach or a mentor through the challenge. So looking at how we worked, it really gave us a lot of chances to break through barriers, especially the barriers of time and distance and even languages. We represented multiple countries on our team. So it gave us a chance to find new and innovative ways to work in our new environment where we're all pretty much working virtually, as well as making sure that we offered the best solution to NOC that we could based on the skills that we brought to the table.
For my side, Tillie Transformers, which is my team name during the challenge with Iowa PCA, it was a team of 5 with lots of energy and passion to discover and research new ideas and perspective. We had different skill sets, ages and background as well, and geographic location. So 4 were from US and 1 from Canada. During the project, we had taken a holistic approach and we resolved the telehealth challenge with the 3 pillars, from business perspective, from communication, marketing perspective, and from technology with software and data analysis. So we started by defining the scope of work, how much outcome we can deliver within the time frame of 4 weeks. Being part of a team of 5 allowed us also to divide and conquer the deliverables according to each member's skill set to get best outcome. So we built a project management Gantt chart, breaking down each framework pillar into a deliverable item. And we had virtual status updates, basically, to be in sync and to share knowledge and skills. Actually, the best moment when the winner team was announced, and my team was the winner out of the 4 teams. We were so happy that we were part of this journey that made a successful change for Iowa PCA.
I'm curious about what you might have found to be the most surprising. What surprised you the most about being part of this team? Could be about what you heard or learned about community health access, or it could just be about your relationships within your team. Open question.
So I can go first. I think one of the things that really surprised us, while some of us who were in healthcare or had a background in healthcare knew about community healthcare centers, we did not realize or appreciate the fact that there was a national association and how much influence that national association can have on policy change and advocacy. That was a big learning aspect for a lot of us. And that also fueled our passion, because we wanted to use or leverage NAC's breadth in the U.S., their relationships in the U.S. with policymakers, and have them be a voice and an advocate for the community centers that we were familiar with in our own homes and in our own communities. So for us, it was really an opportunity to see how can we take a large-scale organization to lean on their strength and their power and their voice to bring that level of resources and policy change and advocacy down to our local communities. So that was a really huge aha moment for us. And I think it really solidified our passion around helping NAC and providing the best solution, best plan that we could moving forward.
From our side, our team really looked at what exists as a challenge for IOPCA, with all once again, that's true, all the policies, all the restrictions, all the, either visually, either like physically within their own infrastructure, but as well when it comes to the telehealth, and now with the COVID and so on. Really, we try to come up with things that will improve them more on the patient side, but as well on the clinical, by looking at education, by looking at the marketing, by looking at the financial, by looking at the software, really looking at what existed last year and what can improve for this year, or in our case, we looked at 3 years roadmap for them to improve in the long term. So there were lots of challenges, but as well, we used really structured and constructive way to break down those silos and to build really a framework for Iowa. And I hope this really helped at the end, because we were the winning team. So I hope our final results will improve in the short term for the Iowa PCA.
So I heard a lot about certainly the complexity, both from you both and from the anchor partners themselves, and also about just this opportunity to have a bigger impact. And that's definitely what, from Pixera Global perspective, we were hoping for, is that when you have organizations that have the kind of broad influence and massive networks that both organizations do in their own ways, that there's an opportunity to contribute to change on a faster timeline. Last question for you both before we go to the open question and answers. What words of advice would you offer either to an anchor partner or to another participant that might be considering, someone might be considering being a participant like yourselves, about what this opportunity can mean in terms of community improvements or personal growth or your relationship with your company and your position?
So I would say the word of advice is to definitely do it, to make the time to make it happen. When I looked at the pitch session and saw all the amazing ideas and concepts that NAC was going to receive, I was excited for them. Whether my team won or not, they got a very amazing set of products out of this experience. So Jason talked about what it would have cost if the organization had gone out and done it. By getting the pro bono work, he has a wealth of ideas and solutions to pick from and to implement and to make their own. So from an anchor partner perspective, even if it requires a commitment of your time, I do feel like at the end, you get a far bigger return on that investment of your time. And then also for a participant, I say the same thing. I actually have a touch point meetup with the team tomorrow, so we're still staying in touch. So my professional network has grown, and I now have not just other contacts at these other companies that I can reach out to, including SAP, who is the solution provider for us, but I also have gained a professional and personal network through this experience. And then through the course of being a part of this challenge, I really got an opportunity to hone and continue to develop certain skills that I can take back into the workplace. such as project management, constraint management, constraint resolution, skill assessment, aligning a business plan to an organization strategy. As an individual, those are all things that I can bring back to the benefit of Medtronic and to be not just a better community member by being part of community advancement, but also being a better employee to my company. So for those who are looking at allowing their employees to do this type of thing, it's also a benefit because they bring back a whole set of skills and professional development as well.
For the community health centers, for the anchor partners, they can benefit from tapping into the diversity of skills coming from multi-companies' knowledge. And this challenge made an impact toward the refinement of existing processes and building roadmaps for telehealth business programs. And actually more like providing digital footprint with telehealth on a grassroots level, close to the affected communities that empowers telehealth systems and improve patients' access and satisfaction. That's also one of our deliverables, customer satisfaction, which is patients in this case. And myself being a development architect, really handling software design is my daily work. This challenge allowed me to be exposed to healthcare domain, to capture business ideas, be part of design thinking sessions, and to brainstorm business journey maps, personas, financial analysis, or other business opportunities that I wouldn't have done in my own daily work. So actually, I was also the team lead for the project and a project manager. And this challenge helped me to utilize many skills, such as using PM methodologies, using the Gantt chart to plan and track the team progress, using agile methodologies to get status updates each day. We started each day a status call, but then we changed it later on as the project matured to bi-weekly. Also using time management regarding prioritizing the task on the time needed, or even tracking each member, getting status update, continuous status update. And also the most important, effective communication. This is a great skills to retain and to bring it back to our daily work at SAP. And also exposure to different perspectives and ideas. And finally, actually more looking into being active listener, being open for a change, being modest to adapt to a change as we progress in the project. And the project itself was a problem solving challenge, which is a great skill set that we all would like to have back in our daily work.
I love it. I'm so glad we're recording this so I can capture everything that you both said to be able to use and share with other corporations that are thinking about this. So couldn't have more exciting answers from you.
Thank you.
Now what I'd like to do is actually to open it up for the audience questions, which I'm being fed here. So if I could ask Jason and Sarah also to join us back here. And let me see if I can get my fancy technology to bring me forth the questions here. By fancy technology, I mean basic Word documents being uploaded to me. So let me start here with a question for Jason and Sarah. Fast forward to a year from now, and we're not holding you to this, but what might a second challenge be for your organization? Having been through this experience, what kind of skills might be beneficial in addressing a particular challenge you could see down the line?
Sarah, you want to jump in first?
Oh. Well, sure. I mean, so the Pixera Global team, I was amazed with the structure that they put together. And I feel like there were elements and pieces of not only what the Pixera process brought forward, but also the way in which the teams that were working on this challenge really, the way that they approached it, that we could use in a number of our like kind of larger, more complex strategic initiatives. And so one of the things that we're thinking about is just care model redesign and care team redesign. Telehealth is obviously a piece of that, but as we look at the broader way in which we're thinking about staffing to get the outcomes that patients deserve and that everybody in the healthcare system deserves, I think care team redesign could be ripe for a challenge for us in the future.
I think building off of what Sarah said, but now putting on that national organization lens, where we can see a challenge is how do we tackle other issues that the field looks to NAC, to lead on. So telehealth was a good moment in time to really look at that. So I can see other areas also building off of this, like care team management, like, we're seeing more growth in DEI trainings and what that could look like. I think health centers, one of the things that came up from one of the groups and it pointed out, and it made a lot of us at NAC think, because we've heard some of this criticism, is we've always gone under this moniker of you see one health center, you see one health center. And the teams challenged us and said, yeah, but you'll never be to scale then. And you'll never be able to think about solutions that can get to scale if you are treating each of them so individually. And so building even a challenge around that kind of notion of how do we move away from that thought process to a larger scalability, focus on all the work that we do could be something that is valuable. And then what could be just fun from a NAC perspective is how do you build a challenge around building these pro bono challenges for PCAs and health centers. And so how is NAC as a partner to like a Pixera to build an ongoing series of these kind of pro bono opportunities, challenges for the whole health center community? And what kind of role would NAC need to play in that kind of infrastructure?
Well, I definitely love that last one. we'll talk some more about that. Let me turn to Susie and to Fouad now and ask you to share a little bit more about your actual solutions. What were the solutions you came forth with, and sort of how did you decide that was going to be the thing you put forward?
Maybe Susie can start.
Okay, I'm happy to start. So as we went through the Voice of the Customer sessions, which was an amazing experience to hear from policy as well as people who are close to the care delivery and represented just a broad spectrum of voices, we began to solidify really on the strength of NOC as being the liaison to all those voices, bringing in all those interested parties and being that hub of information, of needs, of future state. So what we saw was a two-pronged approach for NAC. One where it was protect the floor and raise the roof, and we kind of solidified around those concepts. So how can they put in a strategy to protect and advance what they do really, really well with the training and the delivery and the policy advocacy and being a representative for those PCAs, as well as raising the roof? What are the new opportunities, some of the new networks that they can build, as well as some of the new relationships that they could foster? So for us, when we looked at NAC, it really was about the relationships and bringing people to the table and making sure that the interest of those who are already at the table are protected and could advance, as well as bringing in new partnerships and new voices who could be advocates and liaisons and champions for the community healthcare centers as well. So we built a business plan proposal around that. That involved, looking at funding models, as well as looking at leveraging resources, people that they have access to help make this plan a reality, so that it didn't fall all on NAC's shoulders, but could also be distributed across others to continue to build skills and advocacy and voices within the telehealth and community healthcare spectrum.
So before I go to Fouad, I'm going to hold you for 1 second on your solution. I'd actually like to hear from Jason in the solution you received, including that from Susie's team. Is there something that really stands out to you? One or two things that you're just like, gosh, we really never would have thought of that. What jumped out and surprised you about the solutions?
I think, and Susie brought up that kind of winning phrase that caught our eye the most in their solution. That was the protecting the floor and raising the roof. Is that they really understood, and all the teams did, but the Revolution team captured it as in their approach. We felt that whatever was going to be proposed had to be viable, for us, and we actually scored viability a little higher, in our scoring approach. And so that had to be something that we can build off existing resources and then also look to be innovative and look to be creative. I think every one of the teams came in with the creativity aspect. And what we saw Revolution and that little bit of the edge, that I gave to them is that they took what we had in-house and built upon it. Each of the teams took what we had in different ways and built upon it, but whether it's the marketing or the branding of how they framed it, it just clicked right for us. I think also what we saw was a lot of creativity in the teams, including one of the teams really encouraging us to create an app out of all this, which was very different from the other three teams. And so it got us incredibly excited, like, wow, can we really go down this pathway? And so I would have to say that in every one of the proposals, the creativity of having probably multiple company perspectives of how we can approach something that we're so used to looking at every day gave us some real, fresh ideas. And it was probably one of the most helpful parts of the whole process.
Great. And I'm going to ask both Fled and Sarah to answer the same question, but 1 minute each. And Alex, heads up, I'm going to skip the poll here.
Okay, I'll try within 1 minute. So basically, our framework, we delivered it in a structured way. We started with the business. We looked at the gaps that exist, the funding structures that already existed within the IOPCA, how we can improve it, how we can leverage all the funding that existed. So we provided one of our deliverables, we provided a cost structure, prediction for the next 3 years. We looked at also what they are providing currently as a telehealth service, virtual clinical services, and we also we ask them to really to roll out and to improve that by starting to offer new services in a virtual structure. That's the first business, but there are lots of information provided. There's huge amount of information. The second one, it was regarding the marketing and education. So really the marketing, how they are marketing themselves, how IOPC are marketing, how it's being done, what are their personas. Okay, so let's say we gave them different personas, we brainstorm those ideas, basically homeless people, or it could be someone with digital knowledge, could be people who has no knowledge at all, but they are really in very long, far away distance. Like one of the analysis we did regarding some patients who are traveling more than 3 hours to arrive to a community health center. The third pillar, we analyzed the data, their historic data from last year, 2019, and their data pre and post COVID. And we come up with a great idea, great KPIs, to be honest, nice graphs and so on. And also we analyzed the software, where they have software currently right now. And we also recommended new software, new telehealth software to be applied in their landscape. So really lots of research on the software side, lots of research improving the data, and lots of recommendation on cost structure and improving their communication and education. The education also, this is one other thing. It's not only for the patients, but as well for the clinical, for the it's a doctor, nurses, and the staff overall. So also we took care of all that within our deliverable, our final deliverable.
Great. And just very, very quickly, Sarah, something that jumped out at you as a particular surprise in the solution.
Yeah, I would just say that the winning team and Fayad's team, they just opened up so many possibilities for us in terms of where we go next. The analyses, all of those pieces that Fayad talked about, I think are things that we need to dive down deeper on. And so just having those ideas to start is a way that we can use our data differently, and the thoughtfulness around the personas, those things were just such, like I said, they were presents to open all along the way.
Gifts to open. I love it. Well, I want to just say two quick things in closing, and that is for those who are listening, we have a number of new challenges we expect to be announcing in the coming weeks and months, and we hope that many of your companies will be interested in joining us. And we're also working with several corporations to design their own challenges. So please reach out to Husna Ali Khan if you are interested in learning more. And let me just close with many, many thanks. A round of applause to my excellent panelists today. I could talk to you for another 3 hours. An additional round of applause for all the participants, the anchor partner leads, the stakeholders, and the team at Pixera Global that made this terrific idea reality. Thank you all so much.
Thank you.
Thank you.
Thank you, guys.
Thank you.
Thank you.